Minister, can you explain what you said in the House about China indicating that sick people won't be allowed to leave? Who's going to assess that? How's that going to be decided? And what concerns do you have about it?
Well, first of all, let me say that there's no indication actually yet that any of the people that have asked for help to return to Canada have coronavirus, so that's good news. But there has been some experience of our counterparts that have repatriated their citizens that China is not allowing people with the coronavirus to leave. We suspect for a couple reasons. One, people might be too ill to travel. But two, we are working obviously very diligently together as a global community to prevent the spread of disease.
And the new designation around that the WHO has adopted, what are the implications of that?
So fortunately, we are very fortunate to have Dr. Tam, who I think all of you have spoken with, to be our Chief Public Health Officer of Canada. And she is also an expert advisor at the World Health Organization. And so, of course, has been on the committee that has been stood up for coronavirus since the early days. We are fully in line with the recommendations of the World Health Organization as it stands. And the recommendations really speak to the need to act more globally to protect the health of all citizens of the world by supporting weaker countries that maybe don't have the same kind of coordination that we have in Canada, the same kind of public health systems, or the same kind of resources.
So you mentioned the people that might be told to remain in China if they are already ill. Would that decision be acceptable to the government of Canada? Would you accept to see China refuse them to leave? And my second question is this WHO emergency declaration. What does that mean concretely here? Does it mean that anything is changing?
So in terms of the conversation with the Chinese government, that is a continued conversation. Of course, we're going to put into place measures to protect Canadians who are in China, in the region, regardless of their situation, and that will be different for different needs. I mean, some people don't want to leave, but they need other kinds of supports and services, and so we'll work on a case-by-case basis with the Chinese government and with the Canadians that are in the region to support them in the best way possible. In terms of the World Health Organization's declaration of an emergency, a global emergency, public health emergency, what that means is that really in terms of Canada, we are actually up to date with the recommendations of the World Health Organization. I think there's an implication that we need stronger countries need to support the weaker countries in the world to prevent the further transmission of the illness in a global way. And that's very important for the health of all of our citizens.
Are we going to do that? Are we going to support smaller countries?
Well, absolutely, and we are already. So, as I said, we are already in agreement with the recommendations, and I would say compliance. Not that there's any, enforcement of these recommendations, but certainly on the same track of the recommendations. And what I mean by that is we have international researchers, for example, working on the creation of a vaccine. We have contributed in terms of testing and assessment in our national lab to provide additional information on the virus and the properties of the virus, and we continue to contribute at the World Health Organization through the contributions of Dr. Tam. So we'll continue to assess what kinds of supports need to be in place, and we'll assess as we go.
You told us all week that the risk is low to Canadians. I mean, now with this global health emergency, does that change at all?
It does not change at all for Canadians, no. The risk remains low. Obviously, it is low because partly travel to and from the affected region and from China is becoming more difficult. And of course, we have a very sophisticated system here in Canada, which has been noted, by the way, by the World Health Organization as one that's extremely responsive and able to not only support people that may be under investigation for having the virus, but who are ill. And so
now that it's a global emergency, you're not changing anything at airports?
The recommendations don't indicate that we should, in fact. So we are fully in line with the recommendations, even the new recommendations of the World Health Organization.
How many Canadians now are coming back? Do you have a number? We had 196 before. How many now do you have that want to come back?
I will have to get the number to you. Numbers change all the time, and I don't have an exact number.
Why can't you tell Canadians when the plane will be going and when these people will be coming back?
Because we don't have the information yet, so I'm not going to stand here and give Canadians misinformation.
Why don't you have the information?
Because
help us understand why you don't have that information.
Because we are flying a non-commercial flight into a new country that is under quarantine, that has some very strict protocols about where planes can land and what the protocols might be. And so that requires negotiations with the Chinese government, which Global Affairs Canada is conducting right now.
If the patients when they come back, or the people when they come back, 196, what level of quarantine or isolation might they be on?
So as I said, sick patients, we have been isolating, and we would continue to do that. If any patients were exhibiting symptoms of being ill, they would be isolated until we could determine that, in fact, that they were free of the coronavirus.
So would they be isolated or quarantined? Because you said there was a distinction.
There is a distinction. You're absolutely right. Isolation is what happens when you are ill, and it is primarily, actually entirely, to prevent the spread of the disease to other people. We know the properties of this virus. Right now, that's how much I'm learning French. Right now, the properties of the virus is that it is spread by droplet. And so what we are trying to do, what the public health system is trying to do, and health professionals are trying to do when they isolate people, is to prevent those droplets from infecting other people. That's the purpose of isolation. Quarantine is another process whereby people who are asymptomatic are separated to determine whether or not they will develop the symptoms. And as of now, there is no evidence that this disease is spread without the symptoms. It's really important to remember that. And I'll say this because, in fact, by spreading misinformation and jumping the gun in terms of how the disease spreads, it's creating quite a bit of fear, especially within the Chinese-Canadian community.
So will they be quarantined? His question you didn't answer. Will they be quarantined once they get on that plane before and they land in
As
Canada?
I said, we're working out the processes right now to determine who is coming, what the state of their health will be when they board the plane, and what processes we need to take in order to ensure their health when they return. At no time would we take any measures that would put the health of Canadians here at risk or those people that are coming.
So presumably, though, there's apparently a 14-day incubation period for that virus. So presumably, even if you get asymptomatic people coming, allowed to leave China and arriving back in Canada, you will quarantine them, will you not?
So right now, as you know, the process when people are coming back from China on commercial flights is that they are provided information by border security officials, by Health Canada officials about what to do if they exhibit symptoms. That information is available in simplified Chinese, French, and English, and we are asking people to self-report if they develop symptoms. That has been working, and we know that it is a very effective way to prevent spread of
So
disease.
do I understand you to say no, you're not
No,
planning
what
to
I am saying is
quarantine?
that I am
It's
not-
just- here's what's unclear. I get
Yes.
that you are giving people information how to diagnose themselves if they're symptomatic. But what we're asking is, since people can show up asymptomatic from the heart where the virus has originated, will you plan to quarantine them on arrival in Canada?
We are working out right now a plan to protect Canadians' health here in Canada and ensure that Canadians can be repatriated from the region of Hubei who are in some cases very difficult situations because of the quarantine that China has placed. We will work closely with China to make sure that we do so in a way that's safe for everybody concerned. I am not prepared at this point to talk about what that process will look like. We're working with our officials to make sure that we do so appropriately.
You
Is it
mentioned
safe to
it
say-
had
brought up
You
that when
mentioned
people
that
come through that they are touching screens before they actually see any person. I mean, are you worried at all about the interaction of a person with screens at all and other people using those screens? Is there any health basis?
There hasn't been any indication to date that this has created infections in Canada. We have proper processes in place in airports to do infection disease prevention, as we do in our hospital systems, as we do throughout provincial systems of public health. And so we'll continue to make sure that that technical guidance is available to all of our partners who are working so hard to contain the spread of the
You
illness.
mentioned people coming
One
back
last
from
question,
you mentioned
maybe, please.
people coming back from China. Mr. Davies from the NDP was just here saying now that the WHO is saying that this is a global health emergency. It means that not only people coming from China are a risk to Canada, but people coming from anywhere around the world because all these countries can't control it. Is that correct, or is he being alarmist?
That is
there
not-
a risk
that is-
of any flight coming in with the coronavirus?
I think that anything that we're doing as politicians or leaders or members of the media that will create a sense of anxiety and panic is actually a dangerous road to travel down.
But is he
We know he is not correct. There is no indication right now that we have spread of the illness from other countries other than China and from in very particular, the region of Hubei. And so the process that China has been undergoing to contain the disease, in fact, was praised by the World Health Organization as being extremely diligent given the severity of the outbreak in China. And so the World Health Organization's global emergency status is really, as I said earlier, about helping countries that do not have the same level of sophistication as Canada or perhaps the United States to protect their citizens if in fact they have a citizen who returns from China who is ill or who has been close to someone who has returned from China who is ill. You know, this has been working very well in Canada because we've actually been able to detect cases very quickly, support those people to get better, and prevent the spread of disease. And what the World Health Organization is saying is that we've got to make sure that other countries can do that as well, because it is in the interest of world health that we support everyone in this process.
And does this free up any more money or spending power from your department or the Canadian government in order to act and respond to the declaration?
At this point, it's too early to say what kinds of support smaller countries will need and what the global community will respond with in terms of support, but we are providing technical support, we are providing research support, we are providing all kinds of different assistance in terms of communication through the World Health Organization and to any other partner countries that would like it. We'll have to assess what those needs are as we go along.
Is planning for the plane being strained at
Thank
all
you,
by
sir.
our
Thank you,
diplomatic
sir.
relations?